Our speaker for for this morning, I have had the pleasure of knowing our speaker. I don't even know how many years, but she's an amazing woman of God, amazing wife, an amazing mother herself. And her name is Dr. Benay Johnson. I'm going to read her bio, and then she's going to come to us and she's going to talk to us about how to care for children in COVID with mothers. And there are mothers out here who have children that are in school and what have you. And so she's going to be talking to us in our health and wellness piece about how to care for children in COVID. And maybe there's some other information she'll be able to provide as well if time permits. Okay, so Dr. Johnson is double board certified as a pediatric nurse practitioner and as a neonatal nurse practitioner. She has worked in healthcare for 38 years, with most of those years in pediatrics. Dr. Johnson attended high school and received a bachelor's degree in nursing from California State University in Los Angeles. She has lived in New Jersey since 1990. After moving to New Jersey, she received a master's degree in advanced practice nursing as a pediatric nurse practitioner from Seton Hall University and a postmaster certification from Columbia University in New York City as a neonatal nurse practitioner. In 2018, she returned to Seton Hall University to receive a doctor in nursing practice. She is currently employed as a neonatal nurse practitioner at Bronx Care Hospital System, formerly known as Bronx Lebanon Hospital Center in the Bronx. And she is an adjunct professor for the Pediatric Nurse Practitioner Program with Seton Hall University. Ladies, please, let's welcome in your heart, Dr. Benay Johnson.
Good morning, everyone. It is a pleasure to be with you this morning. I count it a blessing and a privilege to be able to share with you today. Today, I am going to present you some information on children and COVID in relationship to their attending schools, what we should be looking for, or if they're doing virtual learning. This information will be valuable to you also. And also, we're going to delve into like the well-being of our children during this time. So I give blessings to God for being able to do this. And I know that there is a lot of information out there for you to kind of absorb and ingest. I'm just going to give you a little bit of information because it's a lot and we only have so much time. But hopefully you will gain some valuable information for you and your family. So let's get started. So when I was putting this talk together, what I wanted to do was have you just be aware of certain things. We're going to talk about a little bit of the statistics. You know, we talk about statistics. If you watch the news, you see the numbers of COVID. So I'm going to give you some information on that. This data is from yesterday. I updated my numbers. And you're going to learn about some of the challenges that children face in terms of returning to school, and also the challenges that the school face in terms of having the children return. And also, we want to talk about some of the psychological aspects of our children in relationship to this COVID pandemic and returning to school. And then, last but not least, what I would like to do is talk about masks. That's not just children specific, that's adult specific, but children and adults. So this is not going to be political. I just want to review a couple of things regarding math. So when I'm putting together this talk, what I'm thinking about is what we thought we knew, what we know now, and what we are still learning. What everyone needs to keep in mind is that this is a fluid situation, which means nothing is static. It's like we thought we know some things, but as the disease and as the numbers progress, and there's more studies being done on the evolution of the disease and how it is affecting individuals, we are learning more. So you have to remember that we are learning new things as we go along, and that is part of this process because this is something new for us. So let's talk about COVID-19 for a minute, just so for those who don't have like basically a clue as to what is this is. COVID-19 is what we call a novel virus, which means it's a new virus. Now, we have had coronaviruses in the past. A coronavirus could be responsible for a common cold that people have. So it has been out there in their environment. It's nothing new. What's new is this new strand, which is called SARS. You may have heard that, SARS, SARS, CoV-2. That is the Corona 19 virus. So this virus, unlike some of the other coronaviruses, this one is deadly, which we know, which we are seeing, which we are hearing. It is highly contagious, and it is responsible for our 2020 pandemic that we're in. This virus is spread through droplets. Okay, so people ask, well, what are droplets? Like when you cough, when you sneeze, you have large droplets that come out of your mouth, your nose. Droplets are heavier. They are heavy. They can drop to the ground, drop on surfaces, which we'll talk about later. And also what we are learning, or what we have learned along the way, because initially we thought it was just droplets. What we have learned along the way that this can also be spread through aerosol. So aerosol is a finer mist than droplets. So if it's a finer mist, it can travel further and linger in the air longer. So keep that in mind. Also, that's very important. You can also, this can be spread aerosol through someone sneezing. You know, you have the droplets and the aerosol continues on, or also through talking. You know, it can be aerosol spread. All right, so keep that in mind also. All right, so what I'm going to talk about now is what I call uncontrolled damage because we are not in control at this point. So during this section, I'm just going to give you some numbers. You may have been able to look at the numbers on television, but it's just staggering to me every time I look at these numbers, what is going on in the world, and particularly what is going on in our country. So globally, we have over 36 million people, 36.2 to be exact, infected with this disease. Can you think about that number? 36.2 million. Okay. Now, of this 36.2 million who are infected, we have about 1 million people, a little bit over 1 million people who have died globally from this pandemic. Now, the United States, we have over 7 million, 7,583,000. That's a lot of people in the United States. And of that number, we have, our numbers keep going up. I don't know what the count is this morning, but as of last night, we were at 212,000. Okay, a little bit over that. That's a lot. New York City, since I work in New York City, I like to keep track of that, 253,000. And of that, death, 23,000. New Jersey, where I am now, we have 211 over a little bit over 211 cases of COVID in New Jersey. And of that, we have had about 16,161 deaths. So when I talk about the number of deaths, this is combined number of what people that we know died from COVID and people that we suspect that possibly died from COVID. So you have to keep in mind that all the numbers, not everyone will allow an autopsy. Some religions and cultures do not allow that. So these are numbers that we say presumptive, but totally we think, there's a lot of people who have died from this. So this is something that is real. So initially, we thought, okay, adults are dying, adults are getting this, adults are dying. And the initial thought was children did not get COVID. I remember this conversation with some of my colleagues. Oh, children do not get COVID. But what we have learned is that children do get COVID. Yes, 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 they do. COVID-19 is no respect of person, age, sex, nothing. It can come at you. So I wanted, with that, I want to look at, since I'm talking about our children, I want to look at some of the data in terms of our children. So I broke it up into categories. Or actually, the CDC, the Center for Disease Control and Prevention, broke it up for me. They break it down into age groups. Now, for our children that are less than 1 year of age, up to age 4, there have been, listen to this, 102,416 cases in children. Think about that number, over 100,000. How many have died? 35, out of that age group have died. When you get to age 5 to 17, you have 377,135 children infected in that age group. And of that age group, as of last night, 64 have died. So you have a total of, well, you are almost approaching 500,000 of our children being infected. As of last night, 479, 551 children infected with COVID, and a total of 99 deaths from COVID in our children. And I keep saying one is one too many. So what we know about COVID in children is our teenagers are getting hit harder, okay? Even if they are getting infected, they're getting hit harder in terms is more of their numbers. But what we have learned is that when children get COVID-19, they don't get as sick as adults do. However, they do carry a heavier viral load, which means they have more of the virus in them, which makes it more possible for them to spread this disease. So what we like to call them are asymptomatic carriers. They have the viral load, but they're not sick. And if they do get sick, it's a milder disease or it can progress, which we'll talk about a little bit later. All right. So, what are the symptoms of COVID? People, because we're going into flu season and things are going to start to overlap. Okay, so you think about your flu. You have a temperature of 100.4, that's sustained over 24 hours. You're looking at coughing, shortness of breath. You're looking at one of the herald signs is loss of smell. People are complaining that they have this loss of smell, and that's very individualized to COVID. And also in our children, we're seeing GI manifestation or gastrointestinal manifestations in the terms of diarrhea. So you got to keep that in mind. Now, they're just like adults, there are children who are more prone to picking up this virus. And there are children who are diabetic, just like adults. Lung disease like asthma, cystic fibrosis, children who are obese, babies that were born premature, and children who have a hypertension. So one of the famous developmental psychologists, also a psychoanalyst, he's not with us now, he passed years ago, named Erik Erikson. Those of you who are taking psychology, you know his name. He developed the stages of development of the lifespan. And one of the things that he talked about is we have our work, what we do, we go to work. Children, for their work is school. That's what they are doing. That's what their life is about. They go to school. That is their workforce. Okay. So when we talk about us being anxious about going back to work, those of us who are in healthcare, we are anxious about having enough protective gear when we're with our patients. For them, for other people, it's just going back to work. Is there going to be social distancing? Is someone going to decide they're coming back sick? It's the same thing for our children going to school. They think about the same thing. But when we're talking about school, there's besides our children, we have to think about the bigger picture. Everyone entering that building or that space, we have to think about them also, which means include students, teachers, the janitorial staff, those who are in nutritional management, our transporters, those who drive the buses, those who drive the cars for our children, and also our nursing staff. We have to think about this. When everyone who's into that building, we have to be concerned about. So one of the things I talk about or I like to think about is who is making a plan. And when you're making a decision as to whether to send your child to school, or if your child is already in school, whether they should continue that or go back to virtual learning, we have to think about this is a personal decision. And this way, when people ask me, I tell them, this is, as a parent, this is your personal decision. This is something you need to discuss with the child and your family. I don't know your family situation, only you do. You know your child, I don't. So you need to think about what the factors that are involved with sending your child back to school or taking them out. And this is your personal decision as a parent. Also, one size doesn't fit all. What works for you is not going to work for your neighbor, or what works for your neighbor is not going to work for you. This is an individualized personal decision. Keep that in mind. So when you're thinking about things returning to school, or if your child has already returned to school, you think about who is there a comprehensive plan in place and who formulated this plan. What I am hearing from some school nurses actually is that they were not invited to the table when the plan was put in place to return the children to school. The school nurse, can you imagine? I had the opportunity to substitute as a school nurse for several years while my daughter was young. And the school nurse, you'd be surprised. You're constantly bombarded by students being calling themselves sick or really sick, and you're not invited to the table to help formulate the plan for the school. Imagine that. So, also talking about or thinking about screening, testing. Remember, screening is different from testing. Screening, you're just kind of doing a check. How's your temperature? How you feeling? Actual testing is actually doing the test and getting the lab result back. Masks, that's a big part of it. The medical status of children going in and out of that school. Are all the children happy or are healthy? Do some of the children, are they immunocompromised? Those are things that parents have to take into consideration also. And what is the plan if there is an exposure at school? Do they have a comprehensive plan on how they're going to handle this? These are questions parents should be asking, while if your child is in school or even before your child start, if possible. So, when deciding when to return the child to school or what they're going to do in the school in terms of managing this disease, you think about the lifespan of this virus. This virus lasts a long time on a lot of surfaces, like in the air. It lasts up to 3 hours. Now, it could depend on the ventilation of your environment, but on average, it lasts in the air 3 hours. It lasts on stainless steel 2 to 3 days. Stainless steel, those are a lot of your railings in your school. The cafeteria has stainless steel. There's a lot of stainless steel around in schools, okay? In plastics, how much plastics are in school? 2 to 3 days it lasts. Cardboard, you use a lot of cardboard in schools, 24 hours. This virus hangs around. So that's part of the decision making in terms of cleaning and disinfecting that decisions need to be made. Okay, so let's talk about getting to and from school, busing. Um, if you're doing busing or even private car, if you have a car service, um, is there assigned seating for children? Is there social distancing? Is there social distancing? That means you can't have as many kids on the bus, correct? So you got to think about that also. Managing a building, managing a classroom. What are you doing in terms of screening? Social distancing, outdoor classrooms. That topic has been floated around. Outdoor. Uh, but we don't live in Hawaii. We don't live in California where you have more sun and less rain. We live in, many of us live on this conference live in New Jersey. That's not realistic. So some places are splitting the sessions to bring in less kids on certain days and rotating them out. And what we have is in a lot of schools is children are used to rotating from class to class to class. What they're doing now, or some schools, is rotating the teachers so they have minimal people in the hallways and having one-way lanes in terms of walking certain directions. Physical education, how are they handling physical education? Some schools are getting rid of it altogether, and some of them may have it if the children can be outdoors and socially distanced. But see, this is a lot of information and a lot of things that parents have to think about in terms of children returning to school. So, what should be done? What can be considered that can be done? So, before your child even comes to school, check in with your child before they leave for the day. How are you feeling? Please don't send your child to school if they have a fever, if they're not feeling well. Just don't do it. We have enough issues as it is. Temperature checks. Is there someone going to be someone when every child enters the building, every person, every nurse, whoever enters the building, is there going to be someone there to do a temperature check for them? Let's think about that. Is everyone going to be able to sanitize their hands when they walk into the building and throughout the day, throughout the building, which means more hand sanitizers that needs to be available, correct? Or are you going to be able to supply every child with their own personal hand sanitizer? Okay, so there has, as I said before, there has to be ongoing cleaning, disinfecting in the school. And those are questions that you need to ask. Go to your PTA meetings, even if they're virtual, and ask these questions. Are they going to be able to keep soap in the soap dispensers? Are they going to be touchless? Are they going to be able to have toilet paper, seat covers? Are they going to be able to have touchless paper towel dispensers? Now, I can tell you, working as a school nurse in my previous career, that walking to a bathroom even before COVID was a nightmare. There was sometimes no soap, nothing to dry their hands. So, is this going to be an issue? Something to think about. And of course, we tell our children, don't touch anything. Don't touch the walls, don't touch a toy, don't touch a book, don't touch the railing, don't touch any buttons, don't touch any door, and for goodness sake, don't touch another human being. But how realistic is that for your 5 or 6 year old who's in kindergarten or first grade? Are they going to be able to keep them hands to themselves? Only you know your child and what they will and will not do. So, what are some of the other challenges? We talk about challenges, and we're talking about, so they can't touch water fountains either. So, are you going to provide individual water bottles to students? So you're producing more plastic into the environment, but you got to do what you got to do. And we talked about moving class to class, cutting that down. Our touchless equipment that we need in the bathroom. What are we going to do for our cafeteria? There's some schools they're having the kids just eat in their classroom. Sports, the library, playground, supplies. The mask, the hand sanitizer, the facial tissues that you need. And closing the school when there's a positive case. That would cause more of an inconvenience to parents who are working. Okay. And oh, yes, we talked about going to the bathroom. That's a major issue. Or is there regular cleaning, a regular scheduled cleaning, or do they do it once at the beginning of the day and at the end of the day? And is there supervision in the bathroom to keep the little children from playing in the water, playing with the soap? That's realistic. So we're looking at what's expected for our children to do and for the schools to do. and what is realistic. That's the key word. What is realistic? So when you talk about having masks available for everyone, the extra soap for frequent hand washing, the extra hand supplies, the eye goggles if you need eye goggles, who's gonna pay for this? Who's going to pay for more buses if you're trying to socially distance the children? You're going to need more buses, more just bus drivers. Some schools only have one nurse for a district, which she's covering, or he or she is covering the elementary school, the middle school, and the high school. So technically, you should have a nurse in each of those areas, which means you need more school nurses. Who's going to pay for that? And we know that in some states, they have threatened to not approve the school budget if the school had refused to open. Okay, so is that fair? Is that right? And who covers our special services that children need when they go to school? These are questions to ask. Okay, so now that we've gone over school, let's think about this a little bit. So in March, when everything shut down, our world kind of stopped. Now we know that as adults, what about our children? They were on lockdown with us, correct? They couldn't see their friends. They couldn't go out with their friends. They couldn't participate in their sports. Their life stopped just as ours did. Okay. So at home, they have limited access to their friends. They have limited access to family members. Now, some family members who are healthcare and work in the ER, they choose to separate themselves from their family member because of their high rate of exposure. So is your child young and not seeing that parent a lot and wondering exactly, is it me that they're hiding from, or what's going on that, daddy or mommy is downstairs? Also, children who were children who were used to receiving special services in school, they're behind now because that part was taken away. Also, children are missing immunizations because they couldn't keep up with their regular doctor visits, right? So they're behind on immunizations. Also, with being on lockdown, they have more access. They're doing more on their video devices, in their electronics. So they're sitting around not doing anything. What are they doing? Like adults, they're gaining weight. They're gaining weight like us. Parents have lost jobs. Parents have lost income that's not coming back. So with the loss of jobs and income, does this family now need to move to another school district, which means the friends that they were connected to before all this, they've lost those friends. Okay. We've also had in the literature, we've also have seen an increase in domestic violence and an increase in alcoholism and an increase in child abuse. This is where we are. So there's something that by a Dr. Schumann, he coined this as the post-pandemic stress disorder, what our children are reacting to. And just like children, adults have had a hard time with this, so have our children. They have. They've had depression, anxiety, and phobia. Phobia of going back to school, phobia of being out in the world because they don't want to catch anything and bring it home to the grandparents who may be on oxygen, or the parent who may be immunocompromised, or even their sibling who may be immunocompromised. They're scared to do this, or they just scared to go out because they just don't want it. So there's something called, because we talked about how children, if they do contact COVID, that they're not as sick. But those who don't get sick, it can progress, from a mild progression of disease to something that we call multi-system inflammatory syndrome, and it's in children. That is the most deadly complication that our children are dying from. And this is something new. This is something we seen only with COVID. And it kind of mirrors Kawasaki disease in that there is, cardiac, your heart involvement, And this is one of the complications of this multi-system inflammatory syndrome. You know, there's heart problems, there's kidney function problems. Children can develop shock and they die from this. So I was looking at what the progression is and what they have found that children who contact this multi-system inflammatory syndrome, they usually have symptoms 2 to 4 weeks prior to developing the full-blown multi-system inflammatory syndrome. Now, in the United States, in May, looking at this, there were only 64 cases, and we were learning about this. As of last night, there are 1,027 cases of this. There have been 1,027 cases of this. And of this syndrome, we've had 20 deaths of children from this syndrome. And as I said before, one is too many, too many. All right. So these numbers may not even be accurate. There may be more because, as I said, some families, um, due to disclosure issues, they will not disclose, or their religion or their culture prevents them from having autopsies. But there are children who have died from this syndrome, and this is something new. Okay, let's talk about masks. This is a hot button issue, and I'm not going to be political, but as a healthcare provider, I feel it is my duty to talk about masks. And who should wear masks? I'm going to say everyone. There are some exceptions to this. If you have a child that's less than 2 years old, you know, we're like, this child is exempt because we worry about suffocation. You know, they're finding that 2 years and younger, they're really not able to handle this mask. And maybe your child can. And again, only you know your child and what they can do. Any child that does not have the ability to remove a mask on their own, they should not have a mask on either because of the risk of suffocation. If you have a lung issue, you know, if a child has a lung issue, this may be a person also that your healthcare provider may say you should not wear a mask. It'll just make your breathing worse. And the hope is that, you know, if people cannot wear masks, you know, for medical reasons, that others in their environment are wearing the mask to try to protect them as much as possible. So when you talk about masks, you know, it's hard for children, especially the young ones, to keep it on. And again, you know, your child, this is something you should have been practicing from the beginning. Let's practice wearing masks because when you go back to school, you're going to need to keep it on and keep it on all day. How to remove a mask safely, how to prevent the child from touching the mask all day, to teach them not to touch. That's a big deal. And how to remove it properly by removing by the ear loops and discarding. So if the ideal situation is for everyone to have a mask that they can change out every day, like a new mask every day. And we know that's not possible. So if you cannot change your mask every day, then when you take it off, avoid trying to touching the front, but put it in a paper bag or a plastic bag just to seal it away to prevent you from touching it. You know, and if you can, wear a new mask every day. If you have a cloth mask, you know, wash it daily or just change it out every day. And to get our children to engage in wearing masks, we're making them more personalized. On the internet, we can have all kinds of mask designs, you know, for those teenage girls who are fashionistas. We can get a mask to go with every outfit, and maybe that will help them kind of get into the groove of wearing the mask. But it's something that you have to teach your children and ingrain with them. So there are different types of masks. You know, we have the cloth mask that people wear when they're going out. And we also have the surgical masks that are very popular that you see on TV, that the surgeons and the nurses and the doctors are wearing the surgical mask. And those are good for your droplets. They're also good for just being out in the environment. If that's what you want to wear, that's what you want to wear. The respirators, we like to encourage people to say for your healthcare providers or your essential workers, or those who really need that protection. It's a little bit more enclosed and is tighter fit. Be careful though, when you're talking about the respirators, that some of them have that one-way valve. Now, that one-way valve will protect you from when people are talking to you, it'll protect you. But if you have an issue going on, that one-way valve is not going to prevent your particles from transferring out to another person. That's the difference. So you have the respirators that do not have a filter, and those are better because it protects me from you and me from and protects you from me, versus the one way. I'm protecting myself from you, but I'm not protecting you from me. So remember, we're all in this together. We're trying to protect everyone, be socially conscious, and to protect our neighbor. You know, we're looking out for humankind overall. Okay. So in summary, there are a couple of things just to keep in mind. This is a fluid situation. You know, things are just evolving constantly. It seems like every day there's something new. But hand washing, hand sanitizer, disinfecting, your hand sanitizer having at least 60% alcohol base. You know, just avoid touching your mask, keeping socially distanced, frequent cleaning of equipment of your house. Hopefully, wherever you go, they have, if you have to use the bathroom, having seat covers, toilet tissue, touchless soap dispensers, towel, paper towel hand dryers. So, you know, just making sure that you're trying to protect yourself. And also just hopefully they're doors that you don't have to touch the handle. So if there is, you can grab a paper towel and open the door and get rid of the paper towel. So, you know, we talk about testing. Testing is a big issue also. For our children, there's no widespread testing. They're only tested if they're having symptoms. But what some primary care providers are offering to do is they're willing to test your child for antibodies to see if they have been exposed. That would be interesting to know. Have my child been exposed? Hmm, that would be interesting to know. But some families are refusing that, and that's their right. They do not want to know. And some families are okay with that. Okay. So, one of the things that we had talked about, or I had considered, is we talked about a little bit earlier about social inequality, and we're finding this in the school system also. So, when everything shut down, you know, they said do virtual learning. Okay, so if you're in a neighborhood where everyone has internet, chances are people have more than one computer in their household, hunky dory, versus another neighborhood where parent may not be able to afford internet, or there is only one computer or no computer in the household. How is that child supposed to do virtual learning? And sometimes it just has not happened. And there's an inequality in that, right? There's inequality. And what parents have also done, some parents who live in certain neighborhoods and they can afford it, you know, they pool their resources where they're like, okay, we'll rotate houses, but we're going to gather our children together and we're going to hire a teacher, and that person can come in and teach our kids so they're not behind. Another neighborhood, that's not going to happen. So you're seeing the inequality. And what COVID has done, that has brought out the inequality in our educational system. Things that we should have had managed before COVID. You know, every child should have access to a computer or to an internet. So it gives us something to think about. So again, one size does not fit all. What works for you is not going to work for your neighbor, is not going to work for someone else. And we talked about the educational parity. There's inequality. There was a physician, or there is a physician named Hollis, and she said, well, I'm going to read her quote. What is considered best practice today Okay, because we try to practice, do medicine based on best practice, our evidence-based practice, um, may be shown to be incorrect tomorrow. So again, this is an ever-changing situation. It's fluid. We may learn something different that say, oh no, we have to backtrack. We have to think about this now. So keep that in mind as we move forward. Okay, there are a couple of resources that I wanted to give to you. I was unable to do this as a PowerPoint, but I'm going to read some of the resources that you as a parent can go to and look up things for your own learning and just to gain more insight. The Center for Disease Control and Prevention. It's an excellent website and it gives you all kinds of diagrams. You can look in your state, see where the numbers are. You can look at another state and see where their numbers are. The death tolls, you can look at that data. Also breaking up the data into ages and by sex. That is a good website to go to. So cdc.gov/COVID and it'll give you a lot of information or just go to cdc.org and you can or .gov and you can find information. Another one of my favorite websites, especially for parent information, is something called healthychildren.org. Healthychildren.org. So healthy children together to one word .org. That is an excellent resources for parents. It'll give you any type of information that you want in terms of COVID versus no COVID. But it talks about sports and COVID, returning to school and COVID, how to breastfeed in the midst of COVID, how to prepare your children for school, even before school, how to prepare your toddlers and your preschoolers to enter school, how to do school sports. It's a wealth of information for you. Perfect. Healthychildren.org. That's perfect. I encourage parents to look on there if you have any questions about anything related to your child's health. It is an excellent resource for parents. It breaks it down and it's very simple and it's not overwhelming. All right, terrific. So that is it for me. I know this was a lot of information. I know, and it gives you a lot to think about, but hopefully it wasn't too overwhelming and kind of give you some guidance and some insights as to where we are now and where we may be in the future. So that's it for me. Thank you.
Amazing content, Dr. Johnson. I wanted to hear so much more. I'm sure that the mothers online still have other questions. So, ladies, if you have questions, please post them in the comments portion so that we can direct the question to Dr. Johnson. What I wanted to find out, I just wanted to go back. I had heard something in regards to the kids with school. I had heard something in the news maybe about 3 weeks ago that in some of the schools, they are having the children clean their own desks. What would you recommend that a child do, or how a parent would direct their child in that regard? Because it's my understanding that they're not giving them anything that has like antibacterial in it or anything like that. Like, what would you recommend a parent say to their child if they're positioned or presented that to do?
Mm-hmm. That's a good question. So I would say them cleaning their desks is better than it not being clean at all, especially if you don't know if there's a regular cleaning schedule happening here. You know, some parents send their kids with antibacterial wipes to wipe off
Mm-hmm.
stuff. You know, some parents just
Mm-hmm.
do that automatically. But I got to tell you, a lot of teachers, and God bless our teachers, because they spend a lot of money on things that the school district should be spending money on. So a lot of teachers, what I even found
Mm.
in the school, they bought in the tissues, you know, they bought in things to wipe off. So a lot of our teachers are bringing this in for the students to use. Unfortunately, they're using their own money, which is a limited source for them, and I feel bad. You know, if the parent aren't sending things in, then the teachers are supplying this. And if there's nothing, just wiping it off as best as you can, soap and water, like we do our hands, soap and water. But it's best if we can use antibacterial. But I know a lot of schools are trying to have assigned seating, like each time that
Right.
child comes in, that they're only using that desk. But the problem is if they're rotating students in and out, someone else, you can't guarantee that that will be the only desk your child will be the only one using that desk. So you may
Hmm.
want to keep your child may want to have a secret stash tucked away. But then our children tend to share, and you're handing out, and they're surprised
Yeah,
why.
yeah. That's so good, and I think that that's the scary part. If we can just be honest and say that it's a little nerve wracking, and parents may not necessarily know. So just give us some points on what they should have in their readiness packet for their children to go to school. For those who have to send their children to school, what should
Definitely.
they have in their readiness packet?
Their readiness packet, they should have definitely a little thing of hand sanitizer for themselves, an extra mask. If you can afford it, like an extra one or two masks, because masks break, especially the strings, they can break. They can
Yeah.
come off and fall and they end up on the floor. And you don't want your child putting on something that fell on the floor. So, hand sanitizer, maybe a little packet of wipes, and a
Hmm.
couple of extra masks. And maybe even at this point, since they cannot use the water fountains, maybe a bottle of
Mm.
water or a thermos of water so they can at least stay hydrated. Um, hydrated during school. If the water fountain, if they don't have access to this and the school is not providing water to them, you don't want your child to become dehydrated.
Right. Yes, that's definitely important. One other question that came to mind was I heard you said one is too many, whatever we can do. I was baffled by the numbers. I had no idea that the numbers were what they were with the children. And I'm wondering how many children were getting sick long before we really knew or they were able to identify what it was. And I'm
Mhm.
sure, you can speak to how in depth should parents go with their children in talking about the severity of COVID-19?
That's a good question. I was listening to a lecture about a month ago, and some infectious disease specialists, and also some psychologists in terms of how we are approaching our children. And we have a tendency as a society, we want to shield our children. We don't want to give them any bad news. We want them to be in la la land. But the problem is, if they're returning to school, they have to be out in the world. So having an honest conversation about what's going on in terms of COVID, and as have that being the lead is why it is important for them to keep their mask on while they're in school. So just having the
Mhm.
honest conversation. We don't have to say, oh, everyone's dying, drop dead, blah, 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 but just having a conversation. This is what's happening in our world. We have a bad germ. You can put it as a bad germ out there that is making people sick. And I want you to keep your mask on to protect you and everyone around you. So we have to be honest with our children. You don't have to use big words, but just break it down
Right.
so they understand, so they know this is why a lot of people are wearing masks. And this is why I'm expected to keep my mask on.
Mhm. Mhm.
Mhm.
I have I have a question. I found this to be very interesting. How are they managing with the children with sports?
Yeah.
I see
Uh-huh.
that a lot of there's sports going on, and how it
Right.
to me, it's my brain isn't processing how that is okay for them not to wear their mask when they're playing sports, because a lot of the sports
Yeah,
are contact. So
exactly.
how are they managing with that, and what would you recommend? I know some parents are probably keeping their children out of sports or what have you, but
Mhm. Mhm.
kids are kids. They want to participate in things. What would you recommend in that kind of situation?
Right. It's baffling because as you're driving, you see the soccer going on, and I'm just like, what's happening here? And
Right,
it's not like the children are 6 feet apart or anything. They're kind of. I'm just like, I don't understand. But
right.
it, but it's people's
Mhm.
individual decisions, And it's also people get approval, or teams can get approval based on what they say they're going to do. Like they're not going to share balls, or they're not going to share water bottles, or we're going to socially distance. So e- even though they're recommendations, people are going to do what they want to do. And if they feel safe that their child can do this safely, then, that's that, as again, as the parent, is their personal decision. Yeah.
Okay. Okay.
Mhm.
And then the last thing, I don't see any questions in the comments. Again, ladies, this is your opportunity. If you have any questions, I may be asking the questions that some of the parents may have. So hopefully so. But my last question or my last comment really is about vaccines. It's
Mm,
coming. And I know that, just like with every other vaccine that children have, had to take over the years, you make your decision and do what's best for your child.
right.
As a healthcare professional and a parent,
Hmm.
um, what and a grandparent, you
Hmm.
know,
Yes.
what do you what do you propose in terms of the rollout, how parents should operate in the
Okay.
rollout of the
Yeah.
vaccine?
That's a good question. You hear on the news, and this, again, I'm not trying to be political. You hear on the news that we're going to have a vaccine by the end of the year. I'm going to say, no, we're not. And if we are, I wouldn't take it. So it really takes a while to get a vaccine approved, not going into all the steps, but there are clinical trials that have to happen, and not with just a few people. There are clinical trials that have to happen with a lot, millions of people, thousands of people, just so we know that this is safe. And just because someone says it on television, oh, it's going to be safe, we're going to have by the end of the year, I would say not. There was a talk, Columbia University, from a couple of weeks ago, where they went through everything COVID and talked about vaccines. If they are doing this the right way, it's not going to be this year. It may not even be mid next year. It may not be the end to the end of next year. So it's going to be a while. So
Mm-hmm.
with anything, what they're talking about now, they have by the end of the year, I wouldn't trust it. I'm one of the ones, since I am a healthcare provider, I follow the science. So I want to see the studies. I want to see how many people have you tried this on and what were the side effects, and then
Mm-hmm.
make an educated decision on my own. So
Right.
for me and my family. So,
Absolutely.
yes, yes, yes.
Absolutely. I have really said in this time, I don't have small children, but I have said in this time that I'm following the scientists, and
Hmm.
I'm so grateful. We're blessed. I'm grateful to have you, close. We're members of the same church, and so, this information, this wealth of knowledge that you've shared with us today has been something that we definitely needed. And I want to thank you so much for consenting to join us today, ladies. I do hope that you benefited from the information. Please give a virtual round of applause to Dr. Benay Johnson. Dr. Johnson, thank you so much, and you have an amazing rest of the day. Thank you.
You too. Enjoy the rest of your conference, ladies, and have a blessed day. God bless. Be safe.